and welcome to the Plastic Surgery Practice Podcast, a part of the MedCore Podcast Network. My name is Carrie Stevens, and I'm the co-chief editor of Plastic Surgery Practice magazine. Today, I'm talking to Dr. Anna Steve, a board-certified plastic surgeon and practitioner at 9 Plastic Surgery in New York City, who specializes in breast surgery. Dr. Anna, as her patients call her, recently joined us on a podcast to talk about her unique approach to breast surgery. And she's here today to talk about breast reconstruction revision considerations. Dr. Anna, thank you for joining me today.
It's a pleasure, Carrie. Nice to see you again.
Great to see you too. So, before I start, I saw on social media that you recently attended the plastic surgery, the meeting conference, which took place in Boston. How was it?
It was amazing. Such a great opportunity to connect with colleagues, get up to date on the latest standards and technologies and advances in patient care, and really bringing everyone together in that setting is a chance for us to really brainstorm and be creative about how we can make plastic surgery better for our patients.
And I heard you presented at a virtual session. Can you talk about that a little bit?
Yeah, so I was on a couple of different panels. One was on breast implant safety. And the second was on sort of like the new generation of millennial plastic surgery and how, patients are seeking potentially plastic surgery at an earlier age than they were in the past, and what that means for our practice and sort of how that's changed over time.
That sounds exciting.
Hmm.
Okay, so I'd like to get into the bulk of this episode. You and I were emailing back and forth about this topic. And when you did so, you mentioned that women have told you, especially breast reconstruction patients, that they should be grateful for their reconstruction, even though they aren't 100% satisfied with their results. And personally, I felt that way after my breast reconstruction surgery in 2020, which led me to have to get another reconstruction. But can you address this viewpoint that you should just be happy and you should feel grateful that you got any reconstruction and why it's misinformed?
It's a really negative way to look at things. In terms of your reconstruction, I think there really is a true overlap between a reconstruction type of breast surgery and an aesthetic breast surgery. And really, for women on their journey after breast cancer, it's very important to obtain, feeling whole again and feeling that sense of self again. And for some women, the aesthetic part of the breast reconstruction plays a big role in that. And so for me, it's important to really unpack what it is that the patients are trying to achieve in terms of their reconstructive result. If there's things that they're unhappy with and maybe might want to tweak, and also just educating them and keeping patients educated about what the options are, because a lot of women, I think, are overwhelmed because there's so many different possibilities and so many directions that reconstruction can go from the get-go, even from your primary reconstruction, whether or not you choose to use your own tissue or an implant-based reconstruction. So the whole process can be a little bit overwhelming, partly because there's so many options. And so options can be a good thing, but sometimes wading through them and sifting through them can be a little bit challenging, especially in the setting where you're dealing with breast cancer, which is usually the primary concern, is getting rid of the cancer itself.
So, how often are plastic surgeons having to revise reconstruction? Like, can you address the fact that it's typically not one and done, or is it?
So that's a conversation I always have with patients. It's almost never a one and done. And so, in terms of expectation management, that helps patients, feel like, prevent that feeling of like I was botched or like my surgery didn't go as anticipated and now I need another surgery. Because the conversation that I like to have is really, we're going to choose your primary reconstruction. That's the first step. Usually there'll be, nips and tucks that happen along the way. And the goal of those is to get you back to where you, are feeling whole again. And, usually as long as the surgeon has a safe way to achieve the result and the patient's expectations are reasonable, you can keep going with further revision surgeries for a number of different stages until you get where you want to be. And so the real sort of stage process becomes, first of all, achieving like the aesthetic breast mound that you want. And that's really the shape and the position of the breast tissue itself, or the reconstructed breast itself. And then the final stage that some women choose to undergo is the nipple reconstruction and or the areola reconstruction. And that's generally saved for last after you're happy with sort of the final mound, because the nipple position and the areola position is more easily placed only once.
No, that's really good to know. So you told me that breast reconstruction patients often use their pre-cancer breast, or in people like me's, my situation, breast pre-mastectomy preventatively, as their inspiration photos. And that's
Mm-hmm.
so different than a typical plastic surgery patient who could use someone online, a celebrity. And can you discuss how this distinction and how it's important? So using your own self as your
Mm-hmm.
versus using someone that's not you.
Yeah, and I think the main purpose of those inspo photos is to really make sure that as the surgeon and patient, you're connecting on the same visual scale,
Right.
because language is subjective and descriptions can be subjective and interpretable sometimes. But if you really sort of work together to look at what it is you want to achieve visually, um, I find that to be very helpful. So, as you mentioned, the aesthetic patients often use someone other than themselves.
Right.
And the reconstructive patients usually use themselves as their own inspo. So they'll bring photos of themselves prior to having breast reconstruction, prior to having their mastectomy. And so, in some ways, they're very similar, actually, in the sense that they have an idea in their mind. And when they come to me, they don't quite look like that idea yet. And they want to know how they can get there.
No, that's good to know. Can you discuss the misinformation when people say a mastectomy and reconstruction is a free boob job? So,
I think that's a very oversimplification that doesn't give women who have to deal with what it's like to hear that they have breast cancer enough credit and enough empathy, because that's absolutely not how it's experienced. And that's absolutely not how it should be viewed by the public either. So I think that's an important thing to sort of get rid of that idea. I would say on the positive side that, the ability to achieve very aesthetically pleasing results is becoming more and more obtainable. And in that sense, it's great that, I mean, as a reconstructive patient, you could confuse the public into thinking that. I think that speaks volumes for like how far we've come in the reconstruction and the quality of reconstruction. But for sure, that does not address like the underlying psychological burden of what it's like to go under a reconstructive journey.
no, that's great. And actually, that leads into my last question. So, what is exciting you most in regards to reconstruction right now?
I really think that like just the like vast potential, there's so many things you can do. Even like with respect to nipple reconstruction, if you do a nipple reconstruction and you're unhappy with the projection, if you do a second nipple reconstruction, often the scar tissue that's there actually helps you gain more projection. And there's been significant advances in technology that really helps give us an expanded toolkit to help patients achieve what they want. And I think more and more, as we focus on what patients want and what their ideas are, just exploring that and communicating on a level that allows you to understand what it is that patients don't like or what they desire is such an important part of medicine in general. But it's not one that we, historically were great at.
No, thank you so much, Dr. Anna. This was very informative. And to our listeners, be sure to check back soon on the MedCore Podcast Network for the next episode of the Plastic Surgery Practice Podcast. And in the meantime, to catch up on the latest industry news, please check out plasticsurgerypractice.com. Until next time, take care.